How long does Suboxone take to work? Addiction has been a growing problem in the United States for decades, and individuals dealing with chemical dependency often turn to medications like Suboxone to help them cope. Patients may wonder how long it takes for Suboxone to work, as this medication is prescribed to manage withdrawal symptoms and cravings associated with opioid addiction. Sometimes patients may experience different levels of effectiveness with Suboxone, and the time it takes to see results can vary. It's essential to be well informed about the medication to understand how long the effects may take before taking it. This video will discuss everything you need to know about how long Suboxone takes to work. Suboxone is a medication that is a combination of buprenorphine and naloxone, two drugs that work together to help treat opioid addiction. Buprenorphine binds to the same brain receptors as opioids, relieving withdrawal symptoms and cravings associated with opioid use. Naloxone blocks the effects of opioids, making it difficult to get high from taking the medication. Think of it as a safeguard if the individual takes too much of the medicine and has an overdose. Suboxone is taken orally as a tablet or sublingual film and dissolved under the tongue. Only a certified Suboxone doctor can prescribe it. Taking the medication as prescribed is crucial to your safety and the success of your recovery. Never risk taking Suboxone from the streets or anywhere else. Not only is this dangerous, but it can also be illegal. You must take Suboxone as directed by your doctor. Understanding when you should use this medication is essential. Here are some guidelines on when it is best to use Suboxone according to the National Institute on Drug Abuse, or NIDA. Wait for 12 hours after taking your last pain relievers or other opioids like fentanyl or heroin. Wait at least 16 hours after your last oral intake of pain medicine. Wait for 48 to 72 hours following your last methadone dose. Additionally, if users are showing at least 3 of the following symptoms, it may be time to take Suboxone: runny nose, twitching, dilated pupils, chills, irritability, goosebumps, nausea or vomiting, cramps in the abdominal area. NIDA advises those using Suboxone only to take the correct dose. Waiting ample time before taking the medication and following dosage instructions will help ensure the best results. Before taking your first dose, ensure you have waited the recommended period outlined in the previous section. You have to be completely in opioid withdrawal before taking Suboxone. For example, if you have been using heroin recently, wait at least 12 hours after your last dose before taking Suboxone. You should avoid taking Suboxone on an empty stomach to avoid nausea and prevent your stomach from being upset. Place the Suboxone film under your tongue and let it remain there. Please make sure the film or tablet has completely dissolved. This can take anywhere from 2 to 5 minutes. The Suboxone tablet form may take longer to dissolve than the film. The usual time it takes Suboxone to kick in can be anywhere between 20 and 4 to 5 minutes. Sticking to your doctor's instructions can help you avoid experiencing adverse effects like dizziness, confusion, or drowsiness. Remember that you should not use this medication to get high. It is only meant to help those struggling with opioid addiction. Suboxone can have several side effects, but they are generally mild and will dissipate with time. Side effects may include nausea, constipation, sleepiness, headache, and difficulty concentrating. If these symptoms persist for longer than a few days or you experience severe side effects like difficulty breathing or an irregular heartbeat, talk to your doctor as soon as possible. Although this is a treatment for opioid addiction, it is critical to be aware of the risks associated with its misuse. Dependency and overdose are still real risks, so follow your doctor's instructions and do not take more than the prescribed amount of Suboxone. Possibly, you may not feel any effects after taking Suboxone. In fact, some patients may not experience relief for up to 2 hours after taking the medication. That can be because of a few factors, such as improper dosage, waiting too long to take the medication, or incorrect timing. If this occurs, reach out to your doctor, and they will help you figure out what went wrong and make sure that you receive the proper treatment. Providers do not recommend that users take more than the prescribed dose in hopes of feeling something faster. Doing so can lead to an overdose and other dangerous side effects. It is crucial to understand that Suboxone isn't a miracle cure, and it will take time to get used to it. Recovery from opioid addiction is a long and tumultuous journey, but imagine what's on the other side. You can make it through by taking the proper medication, getting into a treatment program, and forming a solid support system. Suboxone is an effective way to start the recovery process, as it can help reduce cravings and ease opioid withdrawal symptoms. Choosing the right clinic to work with and following your doctor's instructions will help ensure success. Along with Suboxone, behavioral therapy and group sessions have proven helpful in recovery. Take the first step and visit SuboxoneDoctor.com. Let us find the right treatment plan and get you on the road to recovery. We are the leading provider of Suboxone treatment and are here to help you.